Dr. Beauchamp, can you tell us about some of the symptoms that people should be watching for in this long-term inflammatory syndrome? What are some of the signs?
Yes, so I'll talk about how we discovered, these cases here in Miami. Of course, they were also being presented in other, states, and also in United Kingdom as well. Actually, that's one of the ones that was reported. So basically, these patients were presenting not with a pneumonia like we always see, right? These patients are coming with pneumonia and hypoxia. They can't breathe. They have to be on a mechanical ventilation. And they're just very sick, and they can say that they were exposed to somebody very close, so that's what we are usually, we see this every day, our bread and butter these days, right? So these cases were presenting with very severe symptoms, right, of multi-organ failure. They would be coming with acute heart attacks and strokes, and they were coming with, kidney function that was severely, affected. And they were telling us that they had history of COVID a couple of weeks or, up to 3 months ago, actually had a case like that. So when we begin with, these patients were, everyone is tested with a PCR in the ER, and their PCR was negative, correct? So we were not suspecting COVID. And then upon investigation, we saw that they had COVID before. So that's when we started using the antibody test, and we analyzed and measured their antibody test, and we saw that their antibody test was very high. So all of these patients had, evidence of previous infection. In one case that had a mild pneumonia, we even had to go and do a whole genome sequencing of the samples from the respiratory cultures to actually show and prove that they did not have the virus itself. So these syndromes are presenting, and it's a result of huge, humongous inflammatory, response that is happening weeks and even months later. We don't know exactly what is the cause of it, but we think that it might be related to maybe post-infection development of thrombus and clots, blood clots everywhere that could cause the anonymous, involvement of very different organs. So this is what we think it could be, but actually right now we need to do more studies and analyze exactly what is the cause. So we have seen that in some of these cases that were reported in the CDC report, they had autopsies, and that's what I'm saying, that they had evidence of microclotting, in many, many different organs, including the brain. So these patients presented with altered mental status, encephalopathy. So they just presented with many different symptoms, except, pneumonia. And they were in mechanical ventilation, placed on mechanical ventilation, but it wasn't because of a bad COVID pneumonia like we always see. So it's definitely a different syndrome than acute COVID. And it really resembles the syndrome seen in children. And that's how they reported having been exposed to parents or had actually COVID before and presented a couple of months later. It's something that we have to make sure that we can tell our patients now that we are seeing and starting post-COVID clinics, to make sure that they come to us with the beginning of the symptoms and not think that, oh, I already had the infection, so I shouldn't worry about it. So the sooner they can get to us so that we can provide with care, the better. But there's a lot of questions that we have to answer. We just, saw the cases, reach out to the CDC, and they were kindly enough to involve us in their discussions with other colleagues all over the world and the United States. And that's how we collaborated with them to report the 27 cases that you saw reported on Friday.
We have a question next from Tina at Science News that I think is a good follow-up for Dr. Beauchamp. And then also, Tina, you had a question for Dr. Jayavira. Please go ahead.
Hi. So actually, I had a couple of questions for Dr. Beauchamp. First of all, can this inflammatory syndrome appear in people of any age, or is it limited to teenagers and young adults?
Yeah. So the majority of all of the patients that were actually reported in this MMWR report, they were all from, from 21 to 50 years old, right? So they were very, very young. And the majority of them have been like that in their 30s and 40s. The patients that we had here in Miami were 46 and 50, but I have seen this syndrome again in people that are 60. We had a 160-year-old and a 65-year-old as well. But from all the reports, we saw that they were pretty young. So the majority are like in between 25 and 50.
And do you have any concerns that any of the vaccines might produce these inflammatory syndromes weeks or months afterward?
We cannot say, we don't know if the amount of antibody is related to the development of this syndrome. We really don't have an answer to that. So we really don't know if the creation of antibodies from a vaccine will definitely be linked to this syndrome. We really think that there's a lot more to that, and it might be just not the actual antibody itself, but just the way that the body is responding. And really, I'm just trying to elucidate a couple of the possible causes, but there's nothing linking, the antibody production, the quantity or the type, related that is linked to this. Right now, we don't have any answers to that.
And one more, there's been a report that some people develop autoantibodies against interferon or against tissues in their own bodies after COVID. Is there any sense that that might be going on in these inflammatory syndromes?
Yes, I mean, we also had that thought. Evidently, we haven't been able to determine very specific autoantibodies that have been, developed. But in some of our patients that we have seen, they might come with other complications, like maybe drug use and other, comorbidities. And sometimes the history of infection with COVID, and together with these, comorbidities and activities that they do, might come together with, put together a real, important kind of bomb together, because they could actually develop antibodies to, let's say, the blood vessels, or it could be also to like parts of the body, and that's when you can see autoantibody production. But definitely, I think that there might be a trigger from COVID itself that it's something that we just don't know right now, maybe genetics that is just predisposing them to cause this. The autoantibodies that we have seen have been linked with other conditions that the patients had, and they just flourished like when they had the infection. So it was like a bad combination with their history or their activities, and then it all came together to produce massive strokes or heart attacks and severe liver failure. So these presentations are very, very severe and striking. It's not what we see on a regular basis. So I really think that we have to do a lot more investigation to determine, and measure these antibodies and see what is the prevalence, and maybe try to find out who are the people that are predisposed to having this create these autoimmune responses after infection.
Great. Thank you so much for your questions.